C mistakenly believed that she was pregnant with twins. As described by her mother, C suffered from anxiety, depression, and oppositional defiant disorder, occasionally drank alcohol, and used to abuse opioids. C had 2 other children who were removed from her custody by Child Welfare Services, CWS, after testing positive for drugs at the time of birth. She mentioned to her mother that she was red flagged by CWS and wanted to have a home birth with the help of a midwife to avoid having her children taken away. Her mother warned her that it wouldn't be safe to have twins at home, especially because the babies would be born addicted to drugs, which C consumed during the pregnancy. In the morning of November 14th, 2 weeks before her estimated due date, C texted Ryan, a man that seemed to be the source of some of the drugs found in her apartment, that she was having contractions, was going to take alcohol and anxiety medication to endure labor, and wasn't going to the hospital because she believed Child Welfare Services would take away the twins from her. She blamed Ryan for not giving her fentanyl to delay labor and ease the pain, and asked him not to tell anyone of her plans to have a home birth. At 6:22 p.m., C texted Sean, telling him that she was in labor at her apartment and asked him not to tell anyone because she didn't want her babies to be taken away from her. Then she texted her friend Ed and asked if he could bring clean towels and sheets for her. Ed said that he couldn't. She then asked him if he could send his brother instead. In the meantime, Ryan texted her saying that she should go to a hospital. C responded that she needed Ryan to give her an opioid because she was in the most pain she had ever felt in her life, and that the hospital probably wouldn't test for fentanyl. Ryan replied that he was going to call for an ambulance, but didn't. Later, Ed's brother arrives and with rubber gloves checks C's cervix for dilation at her request. However, it's not clear if he has any medical training. He also retrieves a bottle of wine and pills that C had asked for, draws her a bath, and leaves at C's request because she claimed he seemed uncomfortable with the situation. The brother said that C asked him not to call 911. C gave birth to baby girl K sometime after 11:14 p.m. on November 14th and before 6:29 a.m. on November 15th, and presumably passed out at some point after the birth. At 6:29 a.m. on November 15th, C texted Ryan saying that she woke up to find a dead baby girl and that she was planning to end her own life because of it. Instead, C makes a call to 911 30 minutes later, crying and saying that she had just given birth. The baby she delivered wasn't breathing and that she had tried to give the baby CPR, but it didn't work. When the dispatcher asked her if she had planned to give birth at home, she said no. Paramedics testified that based on the 911 call, they were under the impression that C had just given birth. However, when they arrived, they found that baby K appeared in a much worse condition than expected for a newborn, as she was limp, had blue-tinted lips, and no pulse. One of the paramedics said he saw the umbilical cord unclamped and thought the cause of the condition was probably blood loss. C told police that she had given birth 2 hours before calling 911, and the reason she didn't call before was because her phone had no battery. She claimed that baby K was born alive, crying, and with possible nasal blockage. In the hospital, the doctor noted that baby K had low blood pressure, and when he inspected her diaper, noticed a large amount of blood and suspected the baby was bleeding. Despite the medical team's efforts, baby K passed away. After C was arrested, she explained to police that in the morning of November 14th, she felt like she needed to have a bowel movement and ended up giving birth while on the restroom. C claimed that she cut the baby's umbilical cord with medical scissors, put some cloth over it, and tried to nurse the baby. Then she noticed that baby K started to have trouble breathing. C said she tried to give her CPR, but that it didn't work. C claimed to have contacted a midwife to deliver the baby in the hospital, and that she wasn't trying to avoid Child Welfare Services. When the police interviewed the supposed midwife, a registered nurse, she claimed to know C, but had no knowledge of her plans to give birth at home, and said that C had never asked her to be a midwife or provide any medical assistance for her birth. When the officers searched C's apartment, they found the medical scissors, as well as a blood-stained binder from the hospital with information on how to take care of a newborn, including paperwork titled Neonatal Release Care Guide. Also at the apartment was a book titled Parenting, Substance Misuse, and Child Welfare, which had some pages that had been tabbed or highlighted, some insurance paperwork for midwife services, and a printout from a website titled Emergency Labor: What to Do If You Have to Give Birth Alone, which was a step-by-step guide that included instructions not cut the umbilical cord because of the risk of bleeding, with advice to wait for medical personnel to arrive. Other items found at the apartment included a contraction timer, a crib, a changing table, baby toys, gauze dressing pads, a fetal Doppler monitor, an opened packet of antibiotic ointment, a plastic or rubber bulb suction, a baby bottle, and other baby care items. The officers also found drug accessories, including a plastic ice cream scoop with crystal meth in it and a crushed aluminum can with heroin residue. C told officers that the drugs belonged to Ryan, who had recently been at her apartment. She said that she had been receiving daily treatment for opioid addiction, but that was the extent of her drug use. The medical examiner determined the cause of death to be perinatal death associated with drug exposure and unattended delivery, and that the manner of death was accidental. However, she agreed that other medical examiners could reasonably have concluded the cause of death to be undetermined. When questioned at the hearing what she meant by unattended delivery, she stated that the phrase was meant to describe the fact that improper procedure was performed at the time of delivery, which included not clamping the umbilical cord upon cutting it. In addition, no sterile procedure was used, and there were no medical personnel present to monitor the fetus upon delivery. She also described bleeding at the umbilical stump and dried blood around the baby's abdomen, the hospital blanket, and diaper, although the amount of blood was unquantifiable. The prosecutors charged C with 1 count of murder and 1 count of felony child endangerment resulting in death. At the end of C's hearing, the judge found sufficient evidence on probable cause to bind C over on the implied malice murder charge. On January 1, 2023, a new law was enacted by the legislature providing immunity from criminal or civil liability for actions or omissions related to a person's pregnancy or pregnancy outcome, including perinatal death due to causes that occurred in utero. Additionally, the legislature declared that an individual's fundamental right to privacy regarding personal reproductive decisions includes the right to make and effectuate decisions about all matters relating to pregnancy, such as prenatal care and childbirth. C argued that she was immune from prosecution based on the new law, and that the prosecution against her was unlawful, as it was based on her actions and omissions concerning her pregnancy outcome and her right to choose an unattended home birth. In the end, the court acknowledged that C could not be prosecuted for her decision to have an unattended home birth or any impact her alleged drug use or lack of prenatal care during pregnancy might have had on her baby, but also determined that the new law did not prevent the prosecution from pursuing charges against C for her actions after her daughter was born alive. As a result, C's petition was denied.